Hi, it's me again. It's bright and early on a Wednesday morning. Sorry to get this done yesterday. Um, Today's topic for Goats 101 is meds and medical issues with goats. Um, I'm not a veterinarian, so I need to be careful how I say this stuff, but um, there's a lot that you can do and a lot that you can avoid problems with if you know what you're looking for. And then don't be afraid to call a vet. And if you don't have a vet, find one. Because if you can't fix it on your own, then the goat needs attention really fast. Okay? So the first off is, what is normal goat behavior? If you don't know what's normal for your goats, then you won't know when something is off. Because their behavior is your first sign that something is weird. If you've got a doe that is usually really friendly and she's banging her head against the wall, she's got a headache. Not from banging her head against the wall, but because it hurts and she's trying to alleviate that pain. She needs a medicine which you cannot get yourself. You can keep some on hand. Dexamethasone is one of them. Um, that's good for brain inflammation. Another is Banamine. Both are that's an anti-inflammatory, so that those will help with pain killing. Um, but you need to get her in a place where she cannot continually bam her head. Okay. If you have a dog who does routinely bam their heads, and I did have one of those, um, give her some other outlet besides the top of her head to whack against. Give her a ball to chase around. Um, this particular doe was the herd queen, and sometimes she would get mad at other goats because they wouldn't listen to her. So she would then take off after herself and wham the wall. She put a hole in the wall, in fact. Um, so observation is your first thing. If you see a goat who's grinding their teeth, that's a sign that there's a problem. Grinding their teeth is a sign of stress and pain. Um, don't just try to figure out, just don't give them an aspirin, which you can do. You need to figure out what's the underlying cause. Um, but while we're on the topic of aspirin, there are a couple different ways you can get aspirin into them. If you don't want to go the route of Banamine, which does have problems in long-term use, Dexamethasone, which has also problems with long-term use. Um, and yes, that is the same Dexamethasone that they're talking about in COVID care. Then aspirin is other choice. The thing is that a ruminant stomach cannot be buffered. And most of the time, human stomachs do need to be buffered. So you need to seek out non-buffered aspirin. Most aspirin these days is buffered, and I do mean salicylic acid, aspirin, not Tylenol, not ibuprofen, not another NSAID, aspirin. Okay, there is a natural form of aspirin. It's called salicylic acid, found in willow trees, pussy willows, alpine willows, weeping willows, anything in the willow family. If you don't have one on your property, plant one. If you can order some online, you can get them from health food stores. You can maybe able to find some. I had a wonderful alpine willow in the front yard for a long time. It got killed by the ice storm, and I haven't been able to find a replacement for it. But all you have to do is give them the leaves, and they'll eat them, unless their stomach is so upset they can't handle it. It's one of those magical things about goats that they will self-medicate. So keeping a willow of some kind around is an important thing to do. If you see tooth, if you hear and see tooth grinding, um, I would start with the aspirin, and if you're going to give them regular human aspirin, give them 2 or 3. If they're full-size bucks or wethers, you might want to go to 4. But if you use a buffered aspirin, you're actually going to be diminishing the action of the gut, so that's why we don't want to do that. So we want the old-fashioned aspirin. If you're going to use baby aspirin, it's like triple the dose because it's a really mild thing, and goats have really tough stomach systems. Behavior is your first indicator. If a goat is usually running around and is just sitting there still, and they're sitting still for hours, they're not just resting, um, then you need to get a temperature on them, or you need to take a look at their manure. Oftentimes, manure is our best telltale as to if something's going on digestively. If they're off their feed, if they're um, sometimes an older goat will have trouble eating hay, but they'll gobble down the grain. That's because they've got a bad tooth on one side or the other. You can have somebody pull the tooth. It's not usually practical, but it can be done. Again, talk to a vet, and if they can't do it, they'll get a hold of a horse floater who might be able to do it for you. Getting into a Nigerian mouth is not easy. Um, but thankfully, that doesn't happen all that often. If you're looking at temperatures, you should be getting a rectal temperature of 101 to 103. And that range is big, but it depends upon the time of year, the ambient temperature around them. It depends upon their activity level. If it's above 103, you're in trouble, especially if it's the dead of winter and they're 103, they've got a fever. If it's blazing hot summer in August and it's 101, they've got something going wrong. I wouldn't necessarily call it a fever, but their temperature is off. So at that point, you've got a couple options. One would be to call the vet, and if you're not familiar with different goat issues, that would be my first suggestion. If you have been around goats for a while, but you don't know what med to use, call a vet and at least ask. There are two meds that you should have on hand. One of them is some sort of antibiotic, either penicillin or oxytetracycline. LA200 or biomycin and Durazvet are all oxytetracycline. LA200 and biomycin are the exact same med, but they're in different carrier solutions. And LA200 stings like the devil. So I try to avoid that as much as I can. In a pinch, I'll use it, but biomycin is a much kinder drug to use. You can get Duravet from Tractor Supply, and that also has a pretty mild carrier. So those are your two basic broad spectrum antibiotics that you need. But remember, when you're using an antibiotic, that we forget what that word means. Antibiotic means against life. So it doesn't care what bacteria it hits. It will hit good bacteria as well as bad bacteria, and that includes the good bacteria in the gut. So if you're giving them an antibiotic, you need to also give them some sort of probiotic, whether it's yeast from sunshine pellets or a probios paste or yogurt. All of those things are all probios. So you want to do something to encourage their healthy gut bacteria while you discourage the infection. The other med to have on hand is either Pepto-Bismol or milk of magnesia. And I've started using milk of magnesia because it attacks things in a slightly different way. Pepto is great if they've got diarrhea, and if you know that they've eaten something that they shouldn't be eating, because it's going to concentrate the kaolin, the clay that's in the Pepto, will pull in the moisture and will cause more constipation, which will help dry up diarrhea. And it will also coat the inside of the gut, which will help the bloat from going crazy. However, milk of magnesia will also coat that gut, and magnesium may be a short supply because it's hard to get in some parts of the country. So I've started giving milk of magnesia in the case of a stomach upset. If I see I know that they're getting a good amount of minerals, but we still are seeing some problems with coat or just unthriftiness. Giving them some milk of magnesia, which has been hard to find, but I've been finding it more frequently. You actually are giving them a coating for their stomach as well as a dose of magnesium, which is really helpful when they're dealing with issues. The other med to have on hand is a vitamin B, either a fortified vitamin B complex or straight vitamin B1. If you wind up with an animal who's got bloat or polio, and we'll talk about what that is in a minute, having those meds on hand is really critical. Okay, so what are some of the issues that you're going to run into? The most common issue we run into is bloat. That's where they've gotten too much sugar in their systems. It might be that they ate too much fresh grass. It might be that they ate too many sugar maples. It might be that they got into the grain and had too much candy. But what happens in bloat is the balance in the rumen between the flora and the acids in the stomach gets out of whack, and the bacteria in the gut go crazy, and they start creating a froth, and that froth just continues to expand and expand and expand. So if you see a goat who's got froth around their mouth, and they may be really blowing up like a baseball, or they're kicking at their gut, or they're grinding their teeth, assume you've got frothy bloat to deal with. You can get a no bloat, which is just a medication. And if you want to have that on hand, it works really well. But you can also do the same type of thing with the vegetable oil. You can give them Gas-X. Anything that will coat that stomach and calm that bacteria, the ruminant bacteria down. If you don't stop the frothy bloat, then the whole body can no longer metabolize the medicines that it needs. And one of those medicines that it needs so much is thiamin. Thiamin is vitamin B1. And if a goat's stomach is working properly, it can synthesize its own vitamin B1. But if it's having a breakdown, that vitamin B is critical for the brain to function. And if bloat continues on to become encephalopoliomyelitis, which we call polio, it's not the contagious polio that humans get, but it is a brain inflammation which can be deadly. It will cause paralysis. It will cause blindness. It will cause death. So you want to head polio off at the pass by getting them first of all, keep things up so they can't get bloat. If they do get bloat, take care of it as quickly as you can. Keep them moving so they just start passing gas out both ends. If they start passing manure, that's a great sign. All of that means the digestive tract is functioning and we're on the way to mending. But if they continue with bloat and just blow up, it will progress onto polio. And I have seen an animal go down with polio and recover, but it took 3 weeks. And during that time, she went blind. Her ears were droopy. She had facial paralysis. And she had a lack of ability. She wasn't paralyzed, but she had no control of her limbs. So it was very difficult for her to walk. What had happened there is that the woman who owned her had gone away for a couple of days, left her husband, who was not fully invested in the farm, to take care of the animals while they were gone. He did not understand goat diets, and they ran shy on grain. He did not want to go to the grain store, they ran shy on hay. He did not want to go to the hay store and get some more hay from the hay guy, so he just increased their grain. And that would be kind of like saying, here, you've got a stomach ache, have some candy. And that doe went downhill really fast. She was paralyzed. She was crate confined for weeks. She was blind, but she loved her person. So she kept on fighting to be with a person. At the end of 3 weeks, her ears began to prop up and vision restored. And within a couple days of that good sign, she was up on all four. And within a week later, delivered a set of triplet doelings, which nobody even knew she was pregnant. So she had maintained her body and those 3 healthy babies for more than a month while lying down. So polio can be turned around. That doe wound up always having a bit of a facial droop, and unfortunately she had to move to a new farm. But she went on to have more babies and be fine. So polio is not a death sentence, but it is a critical situation. Okay. So the first thing to remember is keep that grain up and control how much access to sugars they have. A lot of times we see fresh grass cause bloat. We see goats with access to fresh browse go a little nutso. So if you're turning goats out onto fresh forest to browse, don't do it unlimited. Give them 15 or 20 minutes of time to get used to it, and then bring them back in onto the grass. And then you can up it, increase it, just like you would if a horse goes out of fresh spring grass. They can't be turned out forever. They have to be limited in that fresh grass. Because early green up, whether it's leaves or grass, is a super packed vitamin pill of sugar for the plant. It's why maple sugaring is done when it's done, because it's before bud up. The sugar is at its highest rate of concentration. It's the same regardless of whether you're talking about a maple tree or a tulip. Okay, so if you do have to deal with bloat, contact them and let them know that you're dealing with it, because if it's gonna proceed to polio, they need to know. If you do not have the vitamin B handy, you can get it from them. They may also recommend some kind of a painkiller, which you may not have on hand. So that's why it's so important to have that relationship with the vet. If you can't reach your vet, because sometimes they're just plain busy, because there aren't that many of them around, having an old goat mentor like me can help you too. So what meds should you have on hand? The antibiotics are one thing. You should have a tetanus antitoxin if you're not doing CD&T. What is CD&T? One of the most common bacteria that we run into is a Clostridium bacteria. It's called it causes enterotoxemia, which, as it sounds like, is a stomach poisoning. There are 17 different strains of Clostridium. It is endemic to our world around us. We cannot avoid it. But we can give a CD&T shot, which or a C&D shot, which are just a vaccination that's done to build up immunity against strains C and D of enterotoxemia, of Clostridium. There are other strains, and if you need to have to deal with a stomach upset that's not responding, you should talk to your vet about getting an enterotoxemia medication to have on hand. It's a more broad spectrum approach to Clostridium control. The T in CD&T is tetanus, and goats are prone to running into things that could puncture and be a haven for tetanus to grow. Horses carry tetanus around on them. So if you've got equines on the property or near you, you should be doing CD&T prophylactically. I give it to the mothers before their babies are born. I give it to the babies after they're about 5 weeks old, just before banding, and then they get another booster 6 months after that, and then they get an annual booster either when they are right before the next baby's born or on an annual schedule for my bucks and my wethers. It's really critical that you do it. Lots of people don't want to vaccinate. I understand that. I tried not vaccinating. I do have horses on the property. I have seen animals die of entero. If it's something that I can avoid, I'll do it. I am not so anti-vax that I will put an animal in danger if I can avoid it. There are other antibiotics you might want to have on hand. They are short-term antibiotics, though. They don't last as long. So one of those is Nexel or Extanel. Those are both the same medication. Nexel is actually sold as a powder with a sterile water that you put those together when you need it, and that's a 10-dose supply for a goat. That's kept refrigerated. Extanel is already pre-formulated, and you just have to draw up, but its lifespan is 6 to 12 months. Keeping some Banamine on hand for pain control is a good idea. You can get both Banamine and its generic form from your vet or from a vet supply. And then wormers. And wormers are a whole different thing. Okay. Wormers have been overused, and wormers are critical. It used to be that we recommended worming goats every 6 to 8 weeks. And what that did was teach the worms what medications they were going to fight, and they developed tolerances to them. So Fenbenzadol, which is also sold as Panicure or Safeguard, that is useless in many parts of the country. It's not useless in my neck of the woods because 6 months of the year we're cold enough that worms can't survive. Climate change is making that much more problematic. Okay, I do still use Safeguard on my babies and on my does and milk because it has a shorter milk withdrawal time. Ivermectin is the most common choice for a lot of people. It has a 40-day withdrawal. If I'm going to be milking a goat, I'm not going to milk her for 40 days and dry her off and keep her medicated. So I only use ivermectin on my babies and on my bucks and on my animals that are not in milk. There's moxidectin, which does also have a milk withdrawal that's not terrible. Cydectin is a pour-on, which has supposedly no milk withdrawal, but I give it 24 hours. And then there's Aspirin. Aspirin is also a pour-on. It can also be given orally. It supposedly does not have a milk withdrawal. I give it 24 hours. If the medication says to be given intravenously, it can usually be given orally. If it's a paste, it has to be given orally. And then there's another medication which is called Pyrental or Morantel, and that is also a wormer that's not supposed to have a milk withdrawal. I've also found it to not be very effective. So I would rather give them a medication that I know I'm going to be able to count on than give a medication that makes me feel better but might not make them feel better. So I do keep Safeguard and ivermectin on hand. Zymetrin is a combination of moxidectin and ivermectin together. I also keep that on hand. Those are all 3 horse medications, and they're given by weight. So when you look at that medication, it's going to give you directions on how to use it. Triple that dose, and then do it 3 days in a row, 24 hours apart. A horse has a monogastric system. It has one stomach system, one stomach pouch. And food is constantly moving through that. So it's very easy for the wormer to hit that stomach and get out of the way. A goat has 4 stomach chambers. There's lots of ways where the worms can hide. So we need to up that dose because much of that is going to go right out the other end without even touching a worm. And we need to do it 2 or 3 days in a row so that we make sure that we hit as many as possible. And then wait 10 more days and do it again. Okay? Why that? Because most wormers will hit an adult worm, but they will not hit a worm in egg. or it will hit an egg but will not hit an adult. There are herbal wormers you can use, like Fermetto and Molly's Herbals. I think those are wonderful, but you need to get the worm load down. I don't believe that they are effective fast enough to take a worm load that is almost fatal and get it down to carrying capacity or gone before you need to. That's what a chemical worm will do for you. However, if you can get your worm load down, and you can feed Molly's or Fermetto or whatever herbal you want to use, and do that on a constant basis, whether it's every day or every week or whatever, um, I think that's an optimal way to maintain worm control. Copper, which I mentioned last week, copper is an important part of worm control. They discovered that copper is toxic to worms. It's also toxic to goats if we do too much of it. But keeping your copper load up to optimum will also help them fight off the worms. Why are worms such a problem with goats? Especially in the South, they really have a problem with it. It's because goats have evolved to eat the leaves of plants, and worms are usually planted or dropped in the soil. When we make goats eat off the ground, we introduce them to more parasites that if we let them eat up high where nature wants them to eat. So that's why they've not evolved to be able to handle the worm loads. And again, it's cold up here in northern Massachusetts. It's cold in New Hampshire and Maine and Vermont and all that. But when you get down to areas where it's warm and wet much of the year, even coastal Massachusetts, then you can really have a problem with worm load and with enterotoxemia. So that's why keeping things clean is really important, and keeping on top of your worming regimen, whether it's, I only worm when I feel I need to. I worm when babies are born. I worm before I'm going to start breeding season. I try not to worm during the first three weeks of a gestation. And I try not to worm during active breeding season, just because I think the more chemicals that we've introduced to the zygotes, the more damage we possibly do to that sperm and egg and potential problems for babies. So I try to look at when is a safe time to introduce foreign chemicals to their bodies. It's times when the babies have been basically formed or when there are no babies. Okay? If you have to worm a pregnant doe, try to avoid doing it in the first 21 days. Really try to avoid doing it in the first 6 weeks. After that, it should be fine. But prior to that, until she's actually started forming bones in those babies, you can do a lot of damage. And that's where we wind up seeing extra teats on babies, retained testicles on bucklings, because chemistry was off. And the body of the baby goat just can't figure out what normal is. So we try to avoid introducing abnormalcy to them. Okay. Minerals. Getting back to minerals, which I started on last week and then didn't finish up. Trace minerals are really, really important to goats. We think of them as trace as not being important. It's because they're often toxic if they're in too large a load. But it's important that they have that little bit. And one of the first things we see when we see an animal who's mineral deficient is balding coat or rusty colored black coat. A coat that would normally be black has kind of got a rusty, dingy tinge of rust to it. That's all sign of a copper deficiency. We hear fishtail, where the fur on the tail is no longer a paintbrush. It's got bald spot and a bald area in the middle, or a bald exposed tailbone. Those are all signs of copper deficiency. It can also be zinc or magnesium deficiencies. But copper is the easiest one that we can recognize. A selenium deficiency is one that's going to kill your goat within a year. We don't have selenium in the soil here. If we do, it's like minuscule amounts. In other parts of the country, selenium is toxic. There's so much selenium in the soil. So that's why it's important when you move to a new area that you have your soil tested so you know what kind of minerals you're dealing with. If they don't have enough selenium, they will go blind. They will have their heart stop. Um, I the books do not say go blind, but I've seen it happen. I had a wether here, a pygmy wether, who was healthy as all get out, and then one morning he was blind. And my first course of action at that time, and it often still is let's just give them everything we can give them to get them up to optimum, which meant BOSI, which is a combination of selenium and vitamin E. So I gave Brickle a BOSI shot, and within 12 hours he had his vision back. So he had other things going on with him, but definitely the selenium was an issue. You can generally do a BOSI shot or MUSI or LOSI. Those are all brand names of a selenium shot. Make sure you know which one you're using. I was using BOSI, then I bought some from my vet, which is EC, which is used for horses. It's a twice the dose, twice as concentrated, so I had to give half the dose. So you need to know which medication you're using. If you're using BOSI, it's 1 cc per 40 pounds of goat. If you're using EC, it's 1 cc per 80 pounds of goat. Unfortunately, I sometimes had to give EC to babies, which meant I basically had to give them a drop on their tongue and hope I didn't overdose them. So it's really important. If you have babies born whose legs are buckling in the back, their back legs are locking up and they can't walk, or their front legs are knuckled under like this, give them a drop of BOSI on the tip of their tongue or back in the back of the tongue when they're first born. If it's more than 24 hours, you're going to have to give them a little shot of just 1/10 of a cc of BOSI. Okay, it's really just about enough to fill that hub of that syringe. Speaking of syringes, this is what I use, or they can get them sometimes in one all put together. This is a Lurelock syringe. These are disposable. They are one-time use only. This is a 22 gauge needle or 20 gauge needle. I use 18 to 20. I've seen people use 22 gauge needles, which are diabetic needles. I find them too flimsy, but it's a good idea to have a store of these on hand. You can get them from Jeffers or Valley Vet or KY Vet Supply or any vet supply you want to get. Don't get anything larger than an 18 gauge. An 18 gauge is, and that would be 18, 16, 14, 10. And this is a 3 cc syringe. It's a good idea to have at least a couple 5 cc syringes around, because some medications you're going to need to give 5 or 6 or maybe even 10. If you're dealing with a issue with polio, you may need to give as many as 6 or 8 cc's of medication. And then that's multiple shots if you're having to do a smaller syringe. So I keep 3 cc syringes around with 20 gauge needles. I keep 18 gauge needles around, and just in case I need them. And I try, although it usually gets absconded with, but I try to keep some 5 cc syringes around as well. So you'll need to have a sharps container, and when you need to get rid of these, you take them to your 911 services, and they will dispose of them because this is considered hazardous waste. If you're giving medications to your goats, you primarily, unless the vet tells you otherwise, do them subcutaneously or sub-Q. That means under the skin, not into the muscle. There are nerves in the muscle, and if you give it into the muscle and you hit the nerve, it really knocks them for a whammy. I've done it, and the goat couldn't walk for a couple of days. So use sub-Q. I do it in the armpit, and I would recommend that you have somebody show it to you rather than have me explain it. Because I think there's just some things you need to have a vet teach you how to do. And I'm just not one of those people who should teach you that on a computer. Um, you can use medicines to get your minerals into them. Vitamin B is one of those meds. Vitamin A is one that you can give through medicines. Um, if you give your goats a well-formulated, non-organic grain meal, then you have a pretty good chance of getting a broad-based amount of minerals. But then you need to have your other minerals, whether it's Golden Blend or Sweet Licks or Purina or Manipro or what other kind of goat meat or goat mineral mix that you need that you can get. Give that to them so they can get the minerals when they need to. There will still be there will still be medications that you have to give and minerals that you need to make sure that they get. Copper is one of them. We talked about copper bolusing last time. Selenium is another one. The other ones are a little trickier to give, and so I don't recommend giving them with medications. If you're giving them a good amount of minerals and feed and access to browse, you're pretty much doing everything that you can do. The others, you would need to talk to a vet to figure out what that shortage is, whatever that deficiency is, because a little bit can go really bad if you give too much. So let me tell you my story about how I found out about the best way to give minerals to my herd. We know that we have iron-heavy water here. We know that the iron was blocking the absorption of the selenium and the copper from the feed. So I did not understand the balancing. I did not understand that there are certain things that are needed. Vitamin E is needed in order to metabolize selenium. If you give them selenium but you don't give them vitamin B, they just can't even touch the selenium. I did not understand that some minerals will block the absorption of other minerals. All I knew is that we had a copper problem. We were looking at fading coats, we were looking at bald tails, we were looking at low conception rates, we were looking at low libido. So I decided to just give them a cow stuff. I gave them a cow lick. They were already getting a cattle feed. They were getting Milkmaker 16, which is a cattle feed. And so I gave them a cow lick. And we saw the copper get better, but we saw drastic drops in libido and conception rates and fertility rates. To the point where we had almost no babies for a year. And I had not changed my ration. So I said, well, it must have been the big grain companies. They must have gone to using more GMO stuff. So I switched over to trying to make my own mix with whole grains and with my mineral blend that I was using. And I spoke to my feed store and said, has there been a change in the ration? And they said not that they knew of. They contacted the people, and Blue Seal actually called me back, and their nutritionist called me back and said, tell me what you're seeing. And I was really surprised that a little goat breeder with little goats in Massachusetts would get the attention of Blue Seal Feeds. But they called me and they said, well, what you're running into is blockages, that your copper is getting enough copper through there that it's getting past the iron blockages, but it's now blocking up the kidneys so that the vitamin P and the vitamin K and the vitamin E and all that stuff can't make it through. So you need to have another way to get those vitamins further into the digestive tract, and that's called chelation. And that's where they actually attach the minerals to sugars and amino acids and proteins in the feed so that it makes it past the major filters in the body of the goat and into metabolization. So I thought about that, and that made a lot of sense, because goats would normally get their minerals from what they were eating, and most of what they were eating in leaves would be having sugars attached to it. So I looked at how we could naturally get them that. Kelp is a way to get naturally chelated food, but kelp is also very expensive unless you live in Maine. So Blue Seal does have a couple of lines of chelated feed, and so I switched over to using those. So my meat goat grower finisher is a chelated feed. So all my bucks and all my dry stock are getting a chelated feed. They're also getting a medicated feed to keep the coccidia under control, and ammonium chloride to keep urinary calculi at bay. So that way I kill 3 bad things with one feed, which they like to eat. My Milkmaker 16 is a cow feed. It is not chelated. So I know that my goats that are getting a maintenance ration are not getting chelated grains. So therefore, they need to have mineral access. Much more so than my other stock. Everybody needs access to minerals, but I need to be more aware of what's going on with my milkers. Or my milkers who are not getting milking grain, if that's confusing. Everybody here gets a maintenance ration. And then if they're in milk, they get more grain beyond that. That is my premium dairy goat. And the premium dairy goat from Blue Seal is also chelated. So I know that that grain, although it's high in protein, also has chelated minerals. Once I started using the chelated feeds, I saw a tremendous difference in the coats of my animals. They're not all perfect. Every animal is different. Just welcome to goats. But we did see an increase in conceptions. We saw much more normal rut seasons and much more normal heat cycles. I still give Bosie. I still give copper. I do keep magnesium and zinc around because those are also things that we run into. I have one line of goats here that is prone in the middle of the winter to getting bald, oily, greasy patches in their coat. It has to do with their absorption, I believe, of vitamin A. In the winter, they're not going outside, they're not getting sunshine. We thought maybe it was photoperiodism, which is they need a certain amount of light. Light therapy did not work with that. So we went to making sure they had access to magnesium and zinc with Zinc Pro or a magnesium supplement, and that helped a lot. Excuse me if I'm kind of rambling a little bit here. I'm just, it's early in the morning and I haven't thought things through yet. Excuse me. So that is the basics of animal medicine, with except for hoof care. And when you're dealing with hoof care, well, I need to back it up and go to one other thing too, but let's finish up with hoof care first. The hooves are going to continually grow. If you give them rocks to climb on, they will file some of that off, but you will still need to trim the hooves. Just trim off anything that curls under, or they're going to get elf toes. Their toes are going to get really long. So you want to trim all the dead stuff back to where you just got a full hoof underneath it. And I've started using a hoof planer or hoof rasp. And actually, if you use the hoof rasp, I trim down the extra stuff that I can get with my rose pruners, which is what I use for hoof trimmers. And then I use the rasp, and I just rasp parallel to the hairline on their hoof. And I rasp it back down until I'm seeing good, healthy pink, not red, pink or tissue on a flat surface. And that's the bottom of the hoof. Look at a baby goat when it's first born, and that's the shape of the hoof once it's hardened. Don't do it right away, because when the hoofs are just born, they're very soft. So look at a kid that's like 24 hours old. That's the shape of the natural hoof. That's what you want to maintain. Okay? That needs to be done a couple times a year. Again, depends on how much rock activity you have for them to climb on. The other thing that I wanted to talk about is another way to get minerals into them is Replimon gel. There's something called Multivite or Multimin. Multimin is a shot that you can get through your vet, which is a broad spectrum mineral supplement. Again, too much can kill. So in some parts of the country, that's the way they do things. Here, um, most people up here I use that in New England I know use Replimon gel, which is what I use, and it is a fully inclusive trace mineral supplement that is oral and they like the flavor of. So you can use that as you need to. You may hear people talk about Famacha scores, Famacha. Those are actually, it's a system that measures the eye color of the eyelid. And if it's very red, then it's one thing on the scale. If it's very white, it's another end of the scale. Those are all signs of anemia and worm load. And I'm not going to try to go over how to do fecals because actually I don't do fecals. But I'm going to learn how. But again, that's something for somebody else to teach you. But it is important to know which parasites you're dealing with, and that's what a fecal will tell you. There was one other thing I was going to talk about. Okay, well, when to call the vet. When to call the vet. You should call your vet when your goat will not get up. You cannot make your goat walk. If your goat has a cut that is flapping, you'll need to have sutures done. A vet should do that. If there's been an animal attack or your goat has gotten caught on something, so there may be a tetanus issue, you should call the vet. Anytime you see any kind of pimpling around the mouth, you should let your vet know. Okay, it's probably sore mouth. It's probably going to have to run its course. Your herd should not be commingled with any other goats while you have that, and you should have your vet be aware that you're dealing with sore mouth. I've never had it here. I don't want to have it here. It's a pretty benign disease, but it is highly contagious, including to humans. So you need to talk to your vet and get your sore mouth under control. If you have any abscesses, talk to your vet. You want to have that analyzed to know what's inside the abscess and what's causing it. It might be something innocuous, like an infection because a piece of hay got underneath the tooth, or it may be caseous lavandatitis, CL. If you go to a show, you will need to have your vet give you a whole herd check. That's where they look at all the animals that are going to an inspection to the show. They also look at the rest of the herd to make sure that your animals are not carrying something contagious. If your vet says you're clean to go, bring that paperwork with you. If your vet says don't go, don't go. I know of situations where a person went to a major livestock exposition in the Midwest. He'd been told by his vet not to go. They had been on the far end of a sore mouth outbreak. His goats were all looking clean, but it had not been a full month or so since the outbreak. The vet said don't go. He bullied the vet into letting him go, and he wound up taking the most strident case of sore mouth to that exposition and set off a sore mouth outbreak around the country. So listen to your vet. When they say no, just wait out the show season. You don't have those goats for showing anyway. You have those goats for milk, hopefully, or just for companionship. If you see a break, if your goat looks like it's got a broken leg or if it doesn't want a weight bear, call the vet. There's a lot that we can do as individual goat owners, but we didn't go to school for that. We're not licensed for that. That's what the veterinarians do. We need to let them do their job. Okay? So it may sound scary. In general, I have not had any contagious disease here on the farm in 23 years. I've never had a broken leg on this farm in 23 years. I have had to deal with vitamin deficiencies, polio, listeriosis, other things like that, but I've not had to deal with a lot of the nastiness that other people have had to deal with. So I feel comfortable telling you how to deal with everyday medical stuff, but get to know that vet, build a relationship, and work with them so that you learn as you go, and they know what you know, and then you'll have a healthier herd. So see you Thursday night for the chat, and we'll talk later. Bye.